Hello, I'm Erin, and today I'm going to be demonstrating for you a head-to-toe assessment. A head-to-toe assessment should take no longer than 1 to 2 minutes, and basically it's an opportunity to meet your patient and gather some really important information on them and pertinent to them. If they come in with a specific complaint, you can go back and do more of a focused assessment on that complaint, such as if they're having abdominal pain. I'm still going to do a head-to-toe assessment to make sure everything else is normal, but then I'll go back and concentrate more on their abdomen. There are also a lot of assessment skills you learn in school about checking someone's neurologic status, but I'm not going to get too far into that just because that's something more on a focused exam. Somebody I'm concerned, they have a migraine or they have a facial droop or something that I'm trying to rule them out from having a stroke or anything life-threatening going on with their brain. So for today's demonstration purposes, I'm just going to do the head-to-toe assessment. Starting at the head, working my way down to the feet. This is a systematic approach to gather information on your patient. And I think it's really interesting because when you start at the head, you stay at the head, ask all the questions you have before you move down to the next body part or the next body system. So it's a really organized way of collecting information on your patient. So you're not kind of jumping back and forth from the head to the toes to the stomach. This way we're going from the head to the toe. So this is my patient, Kaylee, and I'm going to start out with her head. I'm going to ask her a couple questions just to make sure that, there's no obvious confusion or anything like that. I can ask her who the president is, what month it is, what day it is, what her birth date is, something like that, just to make sure she's oriented to person, place, time, that sort of thing. I'm also going to look at her skin color, make sure that she's not pale, make sure she's not sweaty, just kind of look for anything that might be out of the normal, and I'm also going to look in her eyes, making sure the sclera, which is the white part of her eyes, are nice and white, there's no yellow, jaundice hues or anything like that. I also can take my pen light and look in her ears, and I'm checking for excess rumen or earwax, make sure that there's no issues there. I can look in her nose, just make sure that, there's no drainage or anything. If it's an elderly patient, I can look at the tops of her ears, her nose, stuff like that, if she's been getting oxygen via nasal cannula, that sort of thing. I also can have Kaylee open her mouth, shine the light in, and just look to see that her mucous membranes are nice and moist, and that there's no kind of obstruction in her throat or no edema or swelling in her tonsils, no exudate, white spots, or anything like that. I can ask her questions, any headache, any sore throat, any nasal congestion, any cold-like symptoms, any earaches, that sort of thing. So then I'm going to move down to her neck. I'm looking for swollen lymph nodes, see if there's any edema or anything abnormal. If she's been in a motor vehicle collision, I'm going to be a little bit more worried about doing the focused assessment on her neck and back. But again, I'm just looking at her neck, just looking for any obvious abnormalities. I'm going to come down to Kaylee's chest. During this time, it's a wonderful time where I can check some of her vital signs. I can be checking her respiration, and I can also check her pulse by listening to the apex of her heart, which is about below the nipple line of about the second rib, and that's the best place where you can listen to good heart tones. We like to do that for a full minute and count and get a good heart rate that way, but for the sake of this demonstration, I'm just going to listen to her lungs and listen to her heart in one place. If I was doing more of a focused assessment, I could listen in several different places, the different valves and such. So we're just going to listen to Kaylee's lungs. I have her take a deep breath and then take a deep breath, and then I'll listen to the apex of her heart. I'm going to go ahead and have Kaylee sit up at this time. If for any reason she couldn't sit up, I could have her roll over, or I could have somebody come in and help me. I'm going to listen in several different places on her back. Just make sure that there's no crackles, no wheezing, no adventitious breath sounds, meaning nothing abnormal. Basically, I just want to hear a nice, clear lung sound. And I want to make sure that I listen down in her bases, because that's where pneumonia likes to start, is deep down in the lung bases where bacteria kind of likes to collect and grow and sit. So good. She has good breath sounds. I'm going to take this time to feel her back, make sure she's not having any pain. Also look again, especially in the elderly, for any skin breakdown, because skin breakdown likes to happen on the bony prominences. And so, elbows, your spine, down at your coccyx, that sort of thing. So I just want to make sure she doesn't have any skin breakdown. So I'm going to have Kaylee go ahead and lay down. And the next thing I'm going to do is come to her abdomen. So she has 4 quadrants in her abdomen. And I just want to make sure to listen to each of those quadrants, making sure that she has active bowel sounds. We don't want them to be hyperactive, and we don't want them to be hypoactive. We just want to make sure that there's movement in there and that we hear some bowel sounds. So while I'm listening to bowel sounds, I'm inspecting. I want to see if Haley's abdomen's distended, if she seems to have bloating, if there's any bruising, any abnormalities. I can ask her questions like, when was your last bowel movement? Was it normal? Have you been having diarrhea? That sort of thing. If she's within childbearing years, I can ask her when her last menstrual period was, or any chance she could be pregnant, that sort of thing. I want to really take this time to gather pertinent information to give to the physician and also to send to my nurses now. So now that I've inspected her abdomen and I've listened to her abdomen, I'm going to go ahead and I can percuss it if I'm concerned about issues with gas or that sort of thing, and it just kind of makes a hollow noise. And then I'm going to palpate in all 4 quadrants. And I'm just looking to see if there's pain when I push in or tenderness, and also when I let go. The right lower quadrant is where your appendix is, and a lot of the time, with patients with appendicitis, they'll be sore when you push in, but even more so when you let go. They'll want to guard the area, and they'll actually want to kind of hold pressure on it. So again, this is really good information to bring back to your physician before they get lab results back, before they send the patient over to radiology. This assessment is huge because you can collect information that's very pertinent to the patient's well-being. So the next thing I'm going to do is go down to the urinary tract and just ask questions. Any urinary symptoms, any frequency, burning, urgency, that sort of thing. And once you've, cleared that, you can move down to the legs. Obviously, if they've gotten in some sort of accident and they have a laceration of their leg, you're going to do more of a focused assessment on that because you're going to want to be measuring and be kind of looking at signs and symptoms of infections. But for now, I'm just looking, I'm going to ask any knee pain, any leg pain, any cramping, that sort of thing. No skin breakdown, making sure strength is the same on each side. I can have her kind of push against my feet or push against my hands with her feet. And then I also can lift or palpate her pulses, which are her pedal pulses, and check for edema in her ankles to make sure that she's perfusing well down to her feet. If there are cardiovascular issues, you'd be thinking about, maybe her feet would be cool to the touch, or maybe when you push down on her nail bed, maybe the color wouldn't come back really quickly, which is called cap refill. If they don't have good cap refill, they may be having issues with perfusion from their heart, or if they have some sort of injury, blood getting to their foot, they have this leg injury, is blood able to make it all the way down to the toes, or is there some obstruction or something like that? So that is pretty much it. That's a quick head-to-toe assessment. Again, when you do a more focused assessment, you can go back and ask more questions specific to those body systems. Something that's huge is, neurologic tests for your brain. There are so many different questions, so many different assessment skills. That's a whole assessment in itself. So we're just sticking to the basics of a head-to-toe assessment. I hope you all learned a lot about a head-to-toe assessment, and if you have any questions about it, please, ask me on the discussion board, and I'll be happy to answer anything that I can. This is Haley, my patient, and my daughter, and thank you, Haley, for doing this today, and I hope you guys enjoyed. Thank you.